If we talk about the ectopic, if we talk about the outside now, pacemaker disabilities or abnormalities, so we have these ectopic beats and ectopic beats. Here you go. So the outside the node, we have the ectopic beats, tachycardia, fibrillation, and flutter. If we talk about ectopic beats, that means you know, outside the SI node, some sort of tissues or cells act as the pacemaker cells. So some cells outside the SI node, but within the heart, they achieve the ability to depolarize the surrounding cardiac muscle fibers, and therefore they can act as pacemaker cells. And these they can either be atrial ectopics or ventricular ectopics, and their reasons for this possible ectopic foci are local areas of ischemia. So due to this disease condition called ischemia, some local areas due to ischemia can act as pacemaker cells, and small calcified plaques. The calcium get collected and accumulated in this heart muscle at some places, and they make calcified plaques. So they also get the ability of depolarizing the surrounding cardiac muscles and toxic irritations. So the irritations that occurs, scratches, there's irritations that occurs within the heart muscle. They also they are toxic. So these toxic irritations can also be uh, can also give them the ability to act as pacemaker cell or depolarization, and also cardiac catheterization. So cardiac catheterization means in bypasses or we just do some let's just google out what is cardiac catheterization. Yeah. um, so cardiac catheterization is a Cardiac catheterization is used to study the various functions of the heart or to obtain diagnostic information about the heart or its vessels. A small incision is made in an artery or vein in the arm, neck, or groin. The catheter is threaded through the artery or vein into the heart. So, this cardiac catheter is a catheter that is used to put into this arm, vein, or neck, vein in the arm or neck, or again, or artery or vein in the arm, neck, or groin, in order to study the various functions of the heart or to obtain diagnostic information about the heart or its vessels. So, this is small incision, they because of these cardiac catheters, they can be used as a they can act as also pacemaker cells. So cardiac, that is it. So if there are two types of ectopic beats: atrial ectopic beats and ventricular ectopic beats. So atrial ectopic beats, they are away from the SA node, opposite to the, so SA node is in the within this right atrium, just below the superior vena cava, so away from the SA node, opposite to the SA direction of conduction. So because of this reason, so we know that when it's opposite to the SA direction of conduction, this P wave actually, the one with the P wave usually resembles the firing of SA node. So when it's opposite direction, it P wave is inverted. So this atrial ectopic beats usually happens in the opposite direction of SA node direction. So its P wave is inverted in the ECG. So we can identify atrial ectopic beats by that, and this can happen in healthy people too. So in athletes, this atrial ectopic beat is a normal condition, right? So other than that, these normal causes like smoking, lack of sleep, and too much coffee ingestion, and alcoholism, and various drugs, so these also can be reasons for atrial ectopic beats. So these various drugs and alcoholism and smoking, they are also reasons for non-communicable diseases. So these atrial ectopic beats also can be a reason for non-communicable, is a like, feature of non-communicable diseases. So special long okay, that is it. And then yeah, and then we have this ventricular ectopic beats. So this is though atrial ectopic beats are normal condition, is a normal condition within that athletes, and also within also us. We can find this when we have smoking and lack of sleep and too much coffee ingestion, and also alcoholism. But ventricular ectopic beat is kind of fatal, like it's not a really good condition. Since originated in ventricular tissue, conduction is slow. So this is when these pacemaker cells are arising within the ventricular tissue, but the conduction is slow. That is totally away from the SA node. So it has an inverted T. The P and QRS are there in the right direction. So this P in T is inverted and QRS is wide above 0.12 seconds, right? Uh, uh, Fast in tissues conduction is slow, so the conduction is slow comparatively. They are passed throughout ventricles, but they don't pass through the Purkinje system. Prolonged extrasystoles can be lethal. So these extrasystoles, ventricular ectopic beats are also known as extrasystoles. So systole means just a contraction of ventricles, right? So extrasystoles, the contraction of ventricles, the point of extra contraction. So they don't pass through Purkinje system, but they pass through the ventricles. Their conduction is slow since they originated in the ventricular tissues. So they are ventricular ectopic beats. Okay. And then if we talk about the long QT syndrome, now we are going to discuss about two reasons for this other type of outside this arrhythmias we talked about. They are long QT syndrome and paroxysmal tachycardia. So they are the two main causes for these three type of outside this diseases such as tachycardia, fibrillation, and flutter. So to discuss about these three diseases, we need to discuss first look at the long QT syndrome and paroxysmal tachycardia. So let's go and check out. So what is long QT syndrome? So as its name suggests, it means that there's a huge gap between the QT after Q occurs, T occurs happens after a quite time, like quite a prolonged time. So QT interval is prolonged. The reason for this is that ventricular repolarization is delayed. So usually after Q, it's a QT after Q, what should happen is that ventricular repolarization, but it doesn't happen because due to a new repolarization during repolarization. So long QT syndrome is due to that we expect repolarization to happen, but it doesn't happen quickly. The reason is that the reason is that but it doesn't happen. The reason is that QT interval is prolonged because there will be new depolarization that has occurred during repolarization as the outside the synod there's a new pacemaker cell. So QT interval is prolonged. So the reasons for this can be, there are three reasons. Either can be congenital, that means that due to this maternal causes or like paternal causes that are coming from your parents or genetic inheritance. You get this due to mutations in sodium and potassium channels. You get this long QT syndrome or acquired ones. So when you have lower level, hypo means lower level of potassium, magnesium, calcium ions in your blood, this long QT syndrome can be acquired, right? Hypo means increased levels of potassium, decreased levels of potassium, magnesium, calcium. It can be a reason for this during repolarization and drugs. So the drugs you use, this can be also a reason for long QT syndrome, such as erythromycin, selective serotonin uptake inhibitors. So erythromycin, we take it's an antibiotic. So selective serotonin uptake inhibitors. So that is serotonin inhibitors used for depression, right? So this condition can lead to atrioventricular tachycardia, fibrillation, and flutter. So first, let's go and check out this tachycardia, fibrillation, and flutter. But before that, we have another condition to discuss. So you can see that in this the long QT syndrome, that this is the ECG graph. Long QT leads to ventricular tachycardia. So yeah, that's an example. So let's talk about paroxysmal tachycardia. So paroxysmal tachycardia is that it occurs in paroxysms and either in atrial or ventricular. Normally lasts for short time. So it means that Um, So it means that tachycardia and ventricular tachycardia. So, very sorry. So if we're talking about paroxysmal tachycardia, it means that it occurs in paroxysms and either in is atrial or ventricular. Normally lasts for short time. If ventricular tachycardia are prolonged, it may become fatal. So paroxysms occurs in paroxysms and either is ventricular normally lasts for short. So let's just Google out what is this paroxysms. um, so paroxysms means actually a fit. Yeah. This paroxysm is a fit, sudden attack of this when in fits. So outburst of sudden attack or outburst of particular emotion activity. So in fact, fits are generally known as medically known as paroxysms. So in fits, we get fits, right? So occurs in paroxysms, and either it can be the atrial or ventricular. So it normally does for a short time. Paroxysmal tachycardia. So if ventricular tachycardia are prolonged, it can become fatal, right? So tachycardia, now we have three types of things to talk about: tachycardia, fibrillation, and flutter. So if we talk about tachycardia, tachycardia can be either atrial or ventricular. So atrial tachycardia is the elicited when an atrial focus outside the SA node is created, discharges regularly at 120 to 130 beats per minute, low blood supply to the ventricles, last for short time, no permanent damage. So it gives out the inverted beat, right? So it's elicited when an atrial focus is outside the SA node and it discharges regularly at 120 to 130 beats per minute. It just so it mean when this high heart rate causes when this high heart rate in the atria, when this atria beats rapidly, blood can't there's no time for blood to get filtered into the ventricles. So because of this, this stroke volume gets down. So because of this, actually lasts for a short time. It only lasts for a short time because of yeah, it's a condition that lasts for a short time. There will be no permanent damage on the stroke one will get reduced. So this inverted P wave again can be seen because SA node is usually found in right atrium, but when another foci is created, atrial focus is created outside the SA node, it usually transmits signals this normal SA direction. So because of that, we get another inverted P wave in tachycardia, like we did in atrial tachycardia, like we did once in atrial ectopic beats, right? So you can see atrial ectopic beat is quite smaller, in like instant, so that's why it's called a beat. But tachycardia, you can see, even though it says it's a short time, it's quite bigger than atrial ectopic beat, right? Because that is why we call ectopic beat, but this is atrial tachycardia. So there's a difference. So ventricular tachycardia. So ventricular tachycardia elicited from one focus in the ventricular tissue. So when it happens, when these pacemaker tissues are formed in the ventricular tissue, it causes about 200 beats per minute, more than 120 beats per minute heart rate. So there will be no P wave at all because the SA node is not generated. Now we have found another one in the ventricular tissue, right? So that means no current or conduction system travels to SA node. So it got no P waves and it got broad or irregular QRS. So the QRS can be broad and irregular. So it can lead to ischemic damage, initiate ventricular fibrillation, pulse deficit. So ischemic damage and initiate ventricular fibrillation. So another reason for ventricular fibrillation is this ventricular tachycardia. So we know that ischemia can be a cause for ectopic beats as well, right? So it can be a cause of ventricular tachycardia. Also, ischemic damage can further increase by ventricular tachycardia. And this pulse deficit means when you check the pulse, there is no pulse. but there's a when you check the ECG, there's this rapid heartbeat. So why a pulse can't be detected is blood doesn't pass through arteries, right? This it can totally goes very fast, so you can't detect the blood pulse. Is when the ventricles pulse, when the ventricles rapidly contract, there's no time to actually pump blood. So the because of that reason, there's no pulse that's observed. So you can see pulse deficit under high ventricular contraction rate 200 beats per minute. No time to fill up the ventricles. Low or no blood is pumped out. Pulse at radial or humeral artery can't be felt at the same rate. There's a heart rate of 200 beats per minute in this. So there's no blood passing through femoral or humeral arteries at this point. So because of that, there's no pulse detector, so we call it pulse deficit. So because there's no time to fill up the ventricle, so that happens, right? So then ECG indicates high heart rate, but palpation is not high. Pulse are not recorded high. Okay, let's wait in another video.